Good afternoon and welcome to CommuniTEA. I'm your host, July, and I'm joined by my co-host, Ms. Portia Harris. We are delighted to have you this afternoon. We have a very important and impactful show planned for you. Tonight is a special edition, and in this special edition, we will focus on COVID-19 in our community. And we are joined by a leading world-renowned infectious disease specialist, Dr. Joseph Gabb. All right. And he will be talking to us about COVID in our community and what, not just specific to Houston, but overall how it's affecting communities of color. But he will also hone in on what's happening right here in Houston. During this afternoon's conversations, your phones are your friends. We want you to utilize those and fill us up with some comments and questions so that as we peruse the comments while he's being interviewed, we can align those so that we can bring them to the forefront during Q&A. So be sure that you are alert and that you're asking questions. Now, I'll turn it over to Portia so she can share with you about membership.
Okay, guys, like I've done for the last 5 episodes. This is episode number 6. We are a membership-based organization. We have power, and there's power in numbers, and we need you. We need your energy. We need your ideas. We need your commitment. So as always, I encourage you to join our wonderful organization, the National Association for the Advancement of Colored People. You can join here at the local level at the Houston branch. If you're in the Houston community, our branch is 6183B. You can go over right now to our website at naacphouston.org and click the Join Us tab. If you happen to be watching from somewhere else and you want to join a chapter or a branch in your local area, you can go to our national website, naacp.org, and click on the Join Us tab. Once you get into the membership tab, it's going to ask you your zip code. And when you put that in, the closest branch to your zip code will populate for you to become a member. It's just $30 for the year. You pay today on May 21st of 2020. You'll be a member for a year with that $30 all the way till May 21st of 2021. And if you want to have a deeper, longer, more committed relationship with the NAACP, I encourage you to become a lifetime member. It's a subscribing membership that you can have. And you can do that for $750 for the Silver Life. And there's more levels after you get to that point. So you can join today, naacphouston.org, naacp.org for the other branches outside of the Houston area. So thank you so much, July. I'll turn it back over to you.
Thank you, Portia. Thank you for sharing that information with us. You will see shortly a link. It will be a pinned link in the comments so that you can use that to join our branch. So be sure to do that. Now I'm going to wait 30 seconds. I'm going to give you all 30 seconds, 25. All right. I want you all to share this. Again, we don't want anyone in our community to miss this extraordinary conversation that is about to take place. It is super duper important that we understand this virus, understand what it's doing, especially with our state and other states reopening fully. So we want you to share it. All right, 5 more seconds, guys. I hope you're sharing it. It's very important that we share this information. So just click that little button at the bottom that says share and share it. Share it to your page, share it to all the groups that you're in, because this is critical information for the Black community across this country and specifically for Houston, Texas. As we stated earlier, today's show is focused solely on COVID-19. And so if you're just joining us, in a few moments, you will see Dr. Joseph Gabb and Miss Belinda Everett, who serves as our housing director, our housing committee co-chair, as well as the secretary of our branch. The secretary of our branch is a very important position. If you're familiar with the history of the NAACP, you know that's one of the most critical positions in our organization. So she brings a wealth of information and knowledge And so she will sit down and have kind of like a fireside chat with Dr. Gathe. I'm sorry. I'm nervous, so y'all forgive me. But she will sit down and have a fireside chat with him. So one more opportunity for you all to share, and I'm going to bring them in. Good evening, everyone. How are you?
Good evening.
Greetings. How are you?
I am great. I am great. So I'm going to leave and I'm going to turn it over to you, Belinda, and let you begin the wonderful dialogue here. And what I'll also do is I will come back in and do some Q&A for you all from the comments.
All right. Well, thank you so much.
You're welcome.
Thank you, July and Portia. You guys, your committees, the Young Adult Committee and the Community Coordination Committee are both valuable parts of our organization. And I do want to applaud you on your efforts for your support for Ahmaud Arbery a couple weeks ago and the support that we were able to show our branches in Georgia. As you know, today's show will be about COVID-19. And I'm sure you're all aware that this disease is affecting our community, the African American community, the hardest. In this crisis, there's one group that is on the front line, and they embody the warrior spirit more than any group that we have helping us through this crisis. And that is our healthcare professional. It is my esteemed pleasure to introduce to me, one of the strongest warriors that we have, the world-renowned physician in the field of infectious disease, Dr. Joseph Gabb Jr. How are you doing, Jeb?
Doing well. Thank you so much for the honor of the invitation and the fantastic introduction.
Well, Joe, I want people to get to know a little bit about you. I had the pleasure of meeting you several years ago, and I'm gonna tell you, I was really impressed with what you have done and where you have come. You were a student at Straight Jesuit here in Houston, where you were an honor student, and then you went on to Trinity and did 4.0 all the years you were there, and went on to Baylor. And the thing that impressed me the most, you were the first African-American resident at St. Luke's. Is that right?
First chief resident at St. Luke's. That's correct.
That's correct. But I think one of the things that's most impressive is the work that you do with the HIV community, and that your practice is one of the largest in the United States for the HIV community. Is that correct?
That's correct. Our solo practice has about 3,000 HIV patients, and they're doing well in our offices, and we're very proud of that. And it is the largest in the United States. We write more HIV prescriptions out of our office than anywhere in the United States. So we're proud of the ability to bring that care to the community.
And most importantly, you have been the pioneer in a number of firsts. I understand you've written over 200 protocols for the treatment in HIV/AIDS. Is that accurate?
That's correct. This pandemic we're dealing with now, we dealt with something similar with the HIV epidemic here in Houston, and we had to fight at that time. And because of that, we had to, get on the ground floor and do many things ourselves. We were able to write protocols, get treatment algorithms, get treatment programs and testing to our community to be able to turn this disease process from one that was certain death to one that is now one that people can live with. And so we're proud of what we've done there. And in a way, it's prepared us to help to deal with this COVID-19 epidemic that we have now.
Yes, you can definitely say you've had the experience to battle an epidemic or a pandemic. Well, Joe, today I want to call on your memory. Do you remember the 2007 campaign of Barack Obama, his presidential campaign, and how he went he went across the country trying to reach America to let them get to know him by having these kitchen table discussions. So today we have a very important topic to cover, and the information that you have to share with us today is really a matter of life and death for many of us. So I'd like to have kind of a kitchen table discussion with you today and let people get to know you, but I only feel comfortable with the information that you're sharing with us. So if I can get started, can I ask you, would you say are the top 3 hot button items you have as it relates to dealing with the coronavirus COVID-19 in your practice today?
So if I had to have three, I would say the following. The first is the COVID-19 cases continue to rise with a disproportionality in our communities of color, both in the numbers infected, the numbers hospitalized, and the numbers that have died. The second hot button item is the response to this COVID-19 pandemic and this public health emergency throughout the country has been unorganized, piecemeal, and unfortunately inadequate. And it's something that we're going to have to deal with on a community level. And the third is, unfortunately, there's a continual tidal wave of misinformation leading to the public distrust, even in our African American communities. And people say, since I don't know what to believe, I'm going to really ignore it all. And that's the worst thing that we can do. And these chats that we have are important to bring the information to the community in a manner that we can understand so we can fight all three of these things to try to solve the epidemic that we are facing at this point.
What would you say are the big myths that we're having to dispel with our community about the coronavirus?
Well, the one single biggest myth is that we as African Americans can't get this. This is not something that affects our community. I feel fine, so I am not worried about this at all. And that is the furthest from the truth that there can be. It disproportionately affects African American communities in every single city in the United States, no matter where you look, as far as percentages of hospitalizations and percentages of death. For example, in Michigan, there's 14% of the cases there, but 40% of the deaths are in an African American community. Same in New York, same in Detroit, same in New Orleans. I can say the same statistics. And so, unfortunately, not only we're not immune to the disease, we're disproportionately affected. And so the first message to get is that African Americans are more prone to get this disease or this infection than anyone. And it's important that we as a community understand that and take the steps it takes to prevent the disease and to get tested and treated.
Wow. That's really almost difficult to understand, that people don't believe that it could affect them, where you can't even turn on the television today and not see the statistics that we are the people that are dying. Well, you know, the NAACP, we have always been at the heart of every fight our community has been in, and that's why we want to go to the heart of the matter here with you today. Can you share with us, what are some warning signs? What should people really want to really pay attention to with their bodies that would compel them to think, I need to go get checked out?
Well, the first warning sign is, if you're African American, you need to get checked out no matter what, because this infection can look like anything. The majority of people don't have symptoms, which in a way is good because you're not going to necessarily get sick, but you can spread the disease elsewhere. That's the first thing. The second thing is, there's this myth, I'm not over 60, I don't have high blood pressure, I don't have hypertension, so I don't have to worry about that. That is absolute also not true. One of the first cases that I saw was actually my trainer at the gym, who's an ex-NFL running back, age 40, better than anybody's as far as being in shape, probably listening to us. And he got deathly ill from this illness from this infection without ever having any other warning signs. And so the first thing is, this can look like anything. Now, I don't want to panic the community and say, oh my gosh, I have a runny nose, so I may have COVID. But what it does say is, you need to have a discussion with your doctor if you don't feel well with anything: headache, nausea, vomiting, diarrhea, cough, chest pain, things that are not what you're usually used to having or used to seeing. You need to at least have a conversation with your doctor about whether or not this could be COVID. At the same time, I'm emphasizing to our community, because of the disproportionality, no matter what you feel like, you should at least get one test to see where you stand. And we'll talk perhaps about that as we go on in our chat. But it's important to do that so you'll know where you stand at the beginning.
Okay. Can you share with us what the coronavirus does, how it attacks the body? Because, you know, some people, you have to get real visual with them, literal. This is what's going to happen to you if you don't pay attention. So can you share with us the impact of coronavirus or the COVID-19 virus on our bodies?
So the COVID-19 virus, when it gets in our bodies, attaches to cells in our bodies. And we used to think that it would only attach to cells in our lungs and in our throats and noses. What we realize is it can attach to all of the cells in our entire vascular system: heart, lungs, kidneys, stomach. Every place that has a blood vessel, this virus can attach to and enter those cells. When it does so, it causes not only damage to those cells, but it calls our immune system in to try to fight that particular infection. And when it does that, our immune system in the fight damages tissues. And so what you end up getting as it attacks the body is not just pneumonia in your lungs, but attacking the blood vessels, causing blood clots, leading to strokes, heart attacks, kidney failure, skin changes. Any part of the body can be infected. And what we don't understand is why some people get all of that and some people don't. I still don't understand, and nobody understands, which is why it's important for you to get tested and see if you have it. It doesn't mean you need to run to the hospital, but what does mean is we need to pay attention to make sure you don't get some of these downstream consequences. And once that happens, then unfortunately none of the treatments work. And again, as I've said, disproportionately, once you get it, those things happen to African Americans more than other communities for reasons that we entirely don't understand.
Are there any significant underlying conditions that would say be more receptive than others?
The biggest ones seem to be hypertension, diabetes, obesity, and perhaps lung problems like asthma or COPD if you've been a former smoker. Those are the big ones. And we see those in people over the age of 60. And we need to pay a lot of attention to that group, but I don't want to pay attention to that group out of not looking at the other groups that may have no symptoms. So you can have absolutely no pre-existing issues, et cetera. So it's the entire community, but also specifically if you have those things, you're more prone, it looks like, not only to get infected, but to have downstream consequences of having that infection.
In watching out or preparing and trying to prevent this spread or just contacting the spread, we have different protocols, I guess. Are there different protocols that would be for children than it would be for adults or even different age groups of adulthood?
Well, that's a good question. And I think the big thing that we need to make sure the community understands is the biggest thing we can do is to not get this disease to start off with. And so prevention is the key. And the prevention is very simple. If you are going out, you must wear a mask because that allows me to protect you. If I have it and I don't know it and I have a mask, I won't spread it to you. The other thing is the social distancing that we speak of. Once someone coughs or spreads the virus because they're coughing or speaking, we want to be as far away as possible. Now, people say 6 feet may not be enough. That's probably true, but at least 6 feet will give you some distance that the virus would have to travel. Those things are critically important for anyone. And as we are going back out in the communities, getting ready to work and going back to be our bus drivers, our beauticians, our teachers, our doctors, our nurses, that is going to be even more difficult. And so we have to make sure we get that done. There was a study that just got done that shows that if you do those things, you're 35 times less likely to get the virus than if you don't do it. And a study just came out from Cornell just this week that said, if we had done the social distancing and the mask 1 week earlier, we would have saved 35,000 lives. 35,000 just for 1 week of social distancing and wearing a mask. Those numbers are incredible. I mean, those numbers just blew me away. And this is from court. This isn't from, just some journal. This is from a major university that said this. And so I say that we didn't do it right then. We have to do it right now because we're going to see those numbers happen again. And I think the community needs to understand, we see the numbers going up, but it only represents about 9% of the population. 92% of us have never seen the virus and are at risk. And so that is a large number of people that are out there that can get the virus. And you see how many people have died with just 9% of people infected. How many people can die if 30%, 40% get infected because we don't have a treatment or a vaccine yet? So the social distancing and the mask and the hand washing needs to be done. As we go down and get to children, it becomes a little bit difficult because children are children.
Yes.
They're going to run and play, and that I don't know the answer to. What are we going to do with our schools? What are we going to do with our playgrounds? Those are things that people are struggling that I unfortunately don't have an answer to, but it's something that we have to decide on a society how we're going to handle it. It will never be perfect, but not to have a plan in place to do what we can to mitigate the spread needs to be done. Do we need to test the kids before they go to school? Do we need to have more classes online than in the schools? All those things need to be talked about because this isn't going to go away in the next few months. We're going to be talking about this for a long time.
Not to stray from that subject, school, but as summer comes about and the temperatures get warmer, there's a school of thought out there that, well, it's the temperatures are warmer, I can't get sick, or the heat kills the virus. We know someone in the White House thinks that heat kills the virus. Can you talk a little bit about, how we should protect ourselves during the upcoming summer months when we want to be outside, we want to go to the beaches, get in the pools? How can we protect ourselves as we enjoy the summer months?
So we have to not depend on the weather being hot to destroy the virus. Perhaps there'll be less spread because there's people are getting out more, but we have to continue the same mitigation things. Can we go down to the beach? The answer is yes, but you have to keep your distance away from people that are at the beach. You have to keep at least 6 feet away. You have to have your mask if you're going to be less than 6 feet away. If you're out there biking or walking or whatever, if you're walking out there by yourself, there's nobody there, you can put your mask in your pocket. But if you're out there and somebody's walking by you or you're on the trail at one of the parks where you're running, there's a lot of people, you're just going to have to do the mask. Do not depend on the weather changing to say that it's going to mitigate where we are. And as the weather cools down, we are all expecting a second wave of COVID-19. And that wave is going to be more difficult because it's going to be dovetailed into the flu season. And so people may be coming in with flu and COVID-19 or one or the other, and we won't know. And those are problems that we're having. So we have to mitigate the spread now so we can prepare for what is going to happen in the fall months.
That's good. Well, part of that preparation and I guess weaponizing ourselves with this virus is having access to healthcare, which is a challenge, of course, in our community. With coronavirus, testing and tracing is, the next best tool in this after getting sick or trying to prevent it is getting tested, but also contact tracing. One of the things we're dealing with now is a lack of available testing. And not only not a lack of available testing, but when you go seek a test, not getting the test. In fact, we have one of our NAACP members who's also a dentist and a city councilwoman who has now, Dr. Letitia Plummer, who told that, she went to get tested 4 times before she was actually given the test and unfortunately was positive. Can you elaborate a little bit on when should we seek testing? And if we encounter, well, I'm not going to test you, what are some best practices for us to do to get tested?
So once you get tested, how about right now? Okay. Everybody here needs to be tested as soon as we get off of this program, because you need to know at least once where you stand, especially if you're African American, because we are disproportionately affected. There is no way I can mitigate the disease in our community if I have no idea who has it. And so we must do it. The testing programs are not as organized as we need to have them. I am working with my team to make sure that we're getting testing strategies better organized in our community. And stay tuned to our sites and everything. We're going to share that. But right now, you can get free testing done at UMMC. I'll give you the number. It's 1-866-333-COVID. And they will tell you where the testing sites are, and you can get tested free of charge. You need to get the test done. Now, I'm going to say that with a caveat. You shouldn't get the test done without someone interpreting the results for you. You don't go to the doctor's office and they draw blood and they send you away with the report and don't tell you what it means. You need to know what that test means, because the test can be false negative. If I got exposed to the virus yesterday, the test today is not going to tell me anything. And so you have to have tests with an educational purpose. Someone needs to explain to you what that means based on your circumstance. Take me as a doctor. If I get tested today and I say, gee, I'm negative, but I just came away from seeing 10 people with COVID yesterday, I need to get tested again a couple weeks from now to make sure I didn't get it yesterday. As we're going back into communities working, as we're going back, as I said, with bus drivers and beauticians and teachers, we are in harm's way to perhaps get infected, no matter how we try to mitigate. And we need to have testing strategies that allow us that are getting in these particular situations to get back and get tested. And so the testing needs to be done with interpretation, and it is available. The last thing I want to say about this, it is important to do it as soon as possible, not only because you need to know, but because this is an opportunity to access healthcare. The one thing that Washington said, and we need to do this before they change their mind, is that Washington will pay for COVID-19 care. Underinsured, no insured, no job, no money, no nothing. You can get health care for free for COVID-19 and state of the art. So there's no reason to not get tested and get into that. You can get care before something happens. And you need to do it before they change their mind up there, because you know how it can be up in Washington.
Would you suggest that someone going back to work, if their employer doesn't require them to get a test, that they get a test anyway?
Absolutely, because you want to know if you have it. If you get a test and you're good, if you get fever or something the next day, maybe you're not as worried about that being COVID. And you don't want to go back to work having COVID, because you're going to end up spreading it to other people or bringing it back to your home. And so you need to know, no matter what your job is, at least once. And again, depending on what your job is, maybe more than that. And so, yes, but at least once as we're getting back out of quarantine or wherever you want to call it and getting back to the jobs, especially jobs where we have essential services with high contact. And those many of us in our community do that. We need to know, and you need to know for the good of yourself as well as those that you're coming home to.
Dr. Gathe, can you spend a little time talking about contact tracing and its importance? And is it done right after diagnosis, or at what point in the process are we talking about contact tracing?
How about it's not done at all? And that's a problem. And contact tracing is not done. Not happening. We're working on making that happen here. And in fact, I'm speaking to another group. We had a talk this morning, and we're going to change all of that. We can't wait for Washington to do what we need to do on our own. Just like the HIV epidemic, I couldn't wait for Washington to fix Harris County HIV in our community. We had to do it on our own, and we have to do this on our own too. There is not organized contact tracing. There's monies out there. They're hiring people. They're getting things organized to do it, but it's not happening quick enough. And so we, on a community level, and as part of the mandates that my group have done, we're gonna tie in testing to contact tracing. What is contact tracing? Contact tracing means when you are positive, we interview you and we attempt to reach out to people to which you may have been exposed to test them. The perfect example is, take me as a doctor, I always use myself. Let's say I'm positive, but I visited my mother in the nursing home, and my elderly father is here at home with me, and my daughter is visiting with her kids. All of those people need to be tested as potential contacts so we can stop those people from getting sick and spreading it to someone else. It just takes one person to spread the disease to a ton of people because we don't contact trace. And so it's important to do that so we can try to mitigate. It is not happening in organized fashion. People are talking about doing it. But again, as the cities and the country is trying to get back out there and open up the economy, it's important that we have that done. And we're working on it, but it is not in hand as of yet.
Well, you said that you have to do this at a community level, and I know that you have been fortunate enough to deal with some really good partners. I understand you've worked with Ms. Tina Knowles Lawson, the Start Small organization, Matthew 25 Ministries, on helping with getting PPE and other much needed materials. Do you think that they'll be a source, or they can be a source for helping with the contact tracing?
Tina Knows and the Be Good Foundation and Start Small, they've all been a godsend. They have reached to us to help us in our task. And because of that, Matthew 25 Ministries has delivered two truckloads, 18 wheels of goods for PPEs, for things needed in our community. And they're reaching out to me to ask me what else they need. Miss Tina Knowles has been a advocate for us, trying to get funds in order to be able to do the things that we've talked about. And we have made what we call the Cure Covet Consortium, which is a group that was co-founded by myself and my wife, Deanna Brogath, who I'm going to have introduced the Cure Covet Consortium about what we're about, and then they're gonna move on from there. There's Deanna.
No, I was doing the social media part.
Okay. Hey, Deanna.
Yeah. Hi, how are you, Belinda? But no, we formed a group called the Cure Covad Consortium, a nonprofit, and our 3-tier is for prevention, testing, and treatment. So we have to educate first, then we need to test, and then we need to find the appropriate treatments that people need. And we are sponsoring a lot of this, so there's no cost. It's just you have to show up and you need to get tested, get the information, and then if you need treatment, we're able to provide that as well. So Dr. Verone, Joe, and I, we all came up with this concept because we felt like it was so needed in our community, and we're just trying to do our part. Like Tina Knowles said, do your part. So this is our part that we're giving back. And those that would like to volunteer with us, please get in touch with me. We have a couple of testing drives about to happen, and we want to get our Houston community involved. So.
Okay. Well, Deanna, first of all, welcome. And
Thank you
for joining our discussion here today. Deanna, I know that you are a professional life coach. And one of the things that the NAACP has approached is just the emotional and mental stress that can come from dealing with this pandemic. Can you share with the audience some words of encouragement in how we are managing our day-to-day lives now, all of us trying to find our new normal and what we might just focus on from a positive perspective?
And that is the word, Belinda, the new normal. And I'm so sorry to say that we probably won't go back to the old normal. This is a new way of living that we have to embrace. It's not even an option. So who likes to do stuff that they have no control over? So that's why people are rebelling. But we have to look at the big picture, the mega view. We're all in this together. So we have to be accountability partners to our neighbors, wear our masks, wash our hands, be a good citizen. It's not just about us. It's about the whole world. And I think this was our pause moment for us to really reassess how we were so compartmentalized with just being about us. It's about all of us. So we need to just take a deep breath, meditate, just kind of take in this new normal and look at it as an opportunity for growth and not so much something that's being forced, but something that may have been in the cards for us just to kind of move into a new direction in our lives and in the world. And just, don't be too hard on yourself. People are going through grief, they're isolated. Those are all big things. So reach out. If you need help, there are programs out there to help. And also you can look at my website, not for anything other than positive, inspirational daily quotes, just to help you get through your day. If that's a little bit that I can give, I'm offering it as a gift.
Would you please share your website?
It's www.coachdbg.com.
All right. You had a great one the other day. It was the lesson in the journey. And it is so true. We have to take the lesson in this journey.
Yeah, and we're all on this journey Together.
Together, and that's the
Yeah.
operative word, together. You're correct.
Perfect.
Well, I'm going to ask our VOG or our host today to, I think, to touch in with her to see if we have any questions or we need to address some commentary from our audience. We can't hear you.
Oh, no.
July. She's talking away and we can't hear her.
My apologies. I asked the whole question. So this question is from one of our viewers. Are individuals with lupus more susceptible to this virus, particularly those who are on hydroxychloroquine?
So that's a very interesting question. Hydroxychloroquine is one that's gotten a lot of publicity back and forth, and that's a whole discussion about where it plays a role in treatment. But there is a suggestion it may have some activity against the COVID-19 virus. What I can tell you is this: when I've talking to my rheumatologist, they have not seen COVID-19 at any higher rate in lupus patients, and perhaps hydroxychloroquine is playing a role in prevention. But I don't want to say we should use it in prevention. I would say if you have lupus and you're on hydroxychloroquine, stay on it, and perhaps, but that doesn't mean you don't wear a mask, you don't wash your hands, you don't socially distance, don't tempt it. But it certainly does not appear to be an increased risk, at least from what I'm seeing in our communities.
Okay. Another question was, is herd immunity applicable here?
Extremely important question. The answer is 100% yes. And I was getting to that when I was saying only 9 to 10% of the population is now infected and positive. It's estimated that it takes 50 to 60% minimum of herd immunity to stop transmission of transmissible viruses. And so we would have to infect another millions of people in order to get that herd immunity. The only way to get herd immunity is a vaccine. A vaccine is a ways off. And when I tell people, even when there is a vaccine, they already have said in the polls, 1 out of 5 people are going to refuse to take it. Flu vaccines every year, 49% on a good day. And so even if we have a magic vaccine, will we get enough people vaccinated to get the herd immunity without to get to that number? And that is a very, very big concern. And we see the number of deaths with 9% infected. What percentage of deaths we're going to have if we have to get to 50 to 60% infected?
Right. Okay. Another question along those lines. If someone has, hold on, see, Belinda's muted here. I'll go to the next one. Okay. Have there been signs of COVID-19 mutating into another strain, or are there other multiple strains?
So the virus grows very quickly, and it is mutating to even begin to get resistant to some of the medications like remdesivir that is being used. It's not clear that it's mutated enough to be a different strain to get infected with another one yet, but that's always a possibility. It's interesting when they've looked at the strains, the one here in Houston looks like it's one of the most infectious out of all when they've looked at that mutation compared to some other places. So that's another shout out for our community in Houston to be cautious and be prepared, because the burglar in our neighborhood is one that breaks in very easily as compared to some other places. So it grows quickly and mutates. It'd be nice to mutate to not get infect people, but it looks like it may be the other way around.
Okay, this is my question. So earlier this week, I was listening to NPR, and one of the guests on the show was speaking about if we did have a vaccine, how would they get people to take it? And he spoke about those same numbers, but he also made a point about there being a shortage of syringes because of this pandemic. So that creates a whole nother layer.
Shortages of syringes, shortages of needles, shortages of storage, shortages of money. Who's going to pay for it? Is everyone going to have access to it for free? None of that. And you have to vaccinate the whole world. You can't just vaccinate Houston. because people are going to be driving in from Louisiana. You can't vaccinate the United States because people are going to be flying up from Brazil. You have to vaccinate billions of people to get enough immunity. And so that is why I tell people we can't rely on waiting for that. I would love to have it. Let me have that in my tool chest, but it's not going to stop everything that we need to stop. We're going to have to stop it on our own, as we've already spoken.
Okay, here's another question. This is from Dion Jones. I have read several articles, and some have stated that some people that have tested positive have a symptom of rashes. Is this true?
Absolutely. We've seen rashes. I had one that was so prominent, I even biopsied the rash. I wasn't actually sure what it was, and it was full of COVID-19. It can have funny looking things in the toes. It can have a skin rash. It can look like anything. So the answer to that question is yes. And because, again, it's because we have blood vessels on our skin. And if the virus gets into those blood vessels in the skin, you're going to see those manifestations there. We don't understand why some people get a rash and some people get hard and some people get nothing. Because what the community has to understand, this disease is new to us too. It's not like we've been dealing with this longer than 12 weeks. And so we're learning every day about what's going on. I'm going around on my patients every day. One, obviously to see how they're doing, but two, for me to learn, what are you seeing? What is happening to you today? So I'll be able to treat the next people better because we see things that happen down the line. It can do almost anything, including a rash.
Okay. Another question that I received via text was the impact that this virus leaves on someone once they get over it, but what it does to the rest of the organs. This person had kidney issues after experiencing COVID-19.
So we have seen, I don't want to call it permanent damage because we don't know. It's only been several weeks, but we've seen people with significant damage both to the lungs, the heart, and the kidneys that we hope over time is going to come back. But because it blocks the blood vessels, it can damage tissues to the point that perhaps they may not come back to what they were before. But we're hoping over time it will. We don't know exactly what you need to do to treat it. You just need time. You need to give medicines and things we need to watch. But it can lead to damage to organs that perhaps may not come back, which goes back to get tested early and get into treatment early so those downstream consequences we don't have to deal with. That's what the real goal is going to be when we try to treat early in the disease process.
Thank you. Here's a question from Michelle Mouton. She says, do you trust the testing like rapid strep? I think she's saying rapid step tests that reflect false negatives at times. Are they having the same issues with the COVID rapid test? And are these false positive negatives, are they accurate?
Extremely important question. And I got to be careful how I answer it.
Right.
I don't trust the test, but I want everybody to get tested. So does that make any sense? The answer is no, but it does make sense. I trust the test in the hands of somebody that can interpret the result. If I send you to get a mammogram, I'm not going to have you read your own mammogram. I'm going to say, hey, I see this. I'm not exactly sure what it means, but I need you to come back and get another one in 6 months, or you're all okay. That's what you need to do because the tests, unfortunately, are not going to get much better. There's going to be a significant number of false negatives. I'm not as worried about false positives. You get false positives, I can come and check you out. The false negatives are the ones that I'm concerned that you have the disease, you have the virus, and you don't know you have it. And so you go on and back out and teacher or whatever else you're doing. It can be up to 40% false negative. And so someone needs to help you interpret the test based on your circumstance to see how accurate it is and whether or not we need to repeat it. So testing, yes, but testing with purpose and education and explanation to know what it means in your individual circumstance is critical.
Okay, we have another question, and I'll take one more after this, one or two more, depending on how long it takes to answer. How many different COVID strands are there? This is because Lysol, Clorox, and other cleaners have listed coronavirus COVID on their products prior to this pandemic. So how many different strands are there to COVID?
So the COVID-19 is a specific strand. The coronavirus infections have been around forever. They're the common cold. Okay. So those have been around for a long, long time. And we've had only a couple of 3 epidemics that we've had in the past. This is obviously the worst one everyone knows about. So this COVID-19 strain is a specific one, different than the other ones, but it is probably killed by hand sanitizers, Lysol, Clorox. And so they're telling the truth on the back. They will kill the virus. Contrary to the president, don't drink it or shoot it up, because that's not going to be real good for you. Just take it. Okay.
All right. Let's see here. I went up to catch some of the older questions. Can I just drop? This gentleman said that Keith, he said he has lupus and all of the symptoms mimic lupus. So what should lupus patients be doing?
That's a real good question. You know, we don't understand why people get lupus, but one of the thoughts is that lupus may be triggered by an infection like a virus, and then your immune system goes haywire after that, even though the virus or whatever the infection goes away. But we've never been able to prove that. And so some of the symptoms that we see are just like lupus or rheumatoid arthritis. And in fact, I've gone to my rheumatologic colleagues that take care of lupus patients to ask me how better to take care of COVID-19 patients. And we're seeing the same manifestations. And I'm learning a lot from them that they've learned with lupus that are actually helping other people at this point. And so the symptoms can mimic, but that is why, again, lupus people that may be having lupus symptoms need to get tested, and perhaps more than once, to make sure we don't have COVID-19 on top of lupus. That's why testing is so important in that type of person that may have symptoms that are other things, but could easily also be COVID.
I see a lot of comments about the different types of testing. So what do you think of using blood samples, swab, and then, of course, the nostril way? The one that I don't want to have to take.
I got you. Okay, so that's important. Let me explain this. Those tests tell you something different. The nasal swab is what we call a PCR test. That looks for the presence of the virus. We need to know if the virus is there, and that person would be concerned may spread the virus. The finger stick test is an antibody test that tells you that you're responding to that you've had it at some point in time, but now your bodies are responding. So it tells you 2 different things. The way the test works, if you get infected today, the PCR testing in your nose turns positive first within the first maybe week, 10 days at max. And then the antibodies come after that, can be up to 7, 14 days after that. So if I get exposed today or tomorrow, the PCR test may turn positive first. The antibody test won't turn positive for 7 to 14 days. So the tests tell you 2 different things. The best world would be to do both, because if you've been recently infected, but not enough to get antibodies, then I want the PCR test. If I got infected in February and didn't know I got it, the PCR test will be negative, but the antibody test will be positive. It means that I've gotten through it and I'm okay. Doesn't mean you can go out there and try to get it again, but it means that I'm probably okay at that point in time. And so both of those tests tell you something different. Both of them have false negatives, but if I can put it together in conjunction with what you tell me about you, what your risks are, how you're feeling, then I can make an intelligent decision about how those tests, even with the potential false negative, are fitting into you. And if I'm not sure, I do the test again in about 2 weeks and compare the 2 and see what's happening. And so they both tell you something different. Ideally, you should get both. If you're worried about spreading, the PCR test. If you're worried about, I think I've had it before and I want to know if I'm immune, that's the antibody test.
The antibody test.
And that's the finger one.
And Michelle just took the question out of my mouth. Are you seeing second time around patients with COVID-19, or have you seen it in your research where people have been reinfected?
Good question. The fair answer is I don't know. What I have seen are people that have had COVID and are still having COVID problems. The question is whether or not they're having COVID problems because it's the same infection, or did they get another one? And that's the part we can't tell. In my heart, what I think I'm seeing is the ones that are having it again are people that never got rid of it the first time. And we've got to strive again with the testing to make sure that once we think we've treated and the patient's okay, that we have clearly closed the book on that and the virus is gone and the antibodies have developed. But there's a lot of controversy about that. And again, when the fall comes, for those who have already had it once, the ones in our community or the 1 million people in the United States have had it, if you start getting sick in October, is it another COVID-19 that's hitting you again, or is it something else? And that is something that we as scientists are going to have to figure out. But it's going to be easy to figure out if I know what hand I've been dealt now. Where are we at the epidemic? Where are you all with the disease right now? Where does your test show now? So then come October, I can use this information and that information to try to make some sense. But if I don't have any test and you show up in October, I have no idea what we're dealing with. That's why I have a critical time now to get our information about where we are, to get tested, to get contact tracing, and to get some modicum of information, especially in our communities, about where we are so we can make an intelligent decision in the future about what to do in the fall and the winter.
Okay. Thank you. I'm going to, in lieu of time, I'm going to make that be our final question from the audience and turn it back over to Ms. Belinda. Thank you so much.
Thank you so much. Thanks for all the excellent questions too.
I have one final question and then I'll close up. The news today reported that there's a pharmaceutical company in Great Britain that is committing to providing a vaccine as early as October that we can actually implement to over 100 million people. Is that feasible? Is that realistic?
No.
I didn't think so.
No, don't. The number 3 said thing that I've said is there's a tidal wave of misinformation. We as scientists never go forward with information about testing and treating for anyone without us studying everything about it. Because this disease is so much in the forefront, everybody's looking for anything to hold on to, any little snippet of information they hold on to. There was one the other day where they treated 8 people with the vaccine and 8 people made antibodies. I said, really? 8? I mean, I have more people in my office working than the 8 tested. And so all these things are small things, but we can't assume any of this is going to come out until it's been scientifically validated. And people say, we're going to have a vaccine in October. I'm good. I'm going to the bar. I'm going to, football game, whatever else. We can't depend on that because we're a long way away, period. So we don't, like Public Enemy said, don't believe the hype.
Okay. Well, I would like to personally thank Portia and July for hosting us this evening, and I really want to give a full NAACP gratitude, appreciation, thank you, gracias to Dr. Joseph Gabb, because you have made an incredible contribution to the medical community and to our community, and we truly need you to remain the warrior that you are on the front lines. And if you have any closing comments for us, I invite you to share them with us.
The biggest, first of all, thank you for having me. It's an honor and a privilege to serve the community I grew up in. Lucian L. Lockhart, I wouldn't be here if he didn't teach me how to read and write back in the day. And being able to come back to the community to serve is an honor and a privilege. The one thing I have to say is I can't solve this pandemic or this public health crisis. It's going to take society. We have to have a societal response. And organizations like the NAACP, I need you to not just support us, but when we have our platforms, tell us how we can make those platforms real for our community. How can I get testing out there? Tell me, NAACP, where can I go test 500 people this weekend? Because I need to know what's going on. And we need the society to say, okay, Gav, you make that testing happen, I'm going to tell you where to go, and we're going to make it happen. Society has to solve this issue, and we're not going to be able to do it alone. It was the same thing with HIV. We couldn't solve HIV until our communities got together with testing. We got rid of the stigma. We said it's all right. If you get it, come get tested and treated. We're okay. We need you all to partner with us. And when we get our platforms together, I'm going to come back to you and say, we're ready. And I need you to be ready too with getting us out there where we need to be to get our people in our community tested, treated, and educated. And we're ready to do that when you get it together with us.
Well,
Dr. Gath, one question that goes with what you just said, and this is from Bishop James Dixon. He asked, how can church leaders assist you? What are some specific things that pastors and ministers and bishops can be doing at this time to help you and the medical community stop this virus?
Here's what I need from our communities. I need you to organize your congregations and your groups to tell them we need to get tested, and tell me how we can make that happen. We're going out to Pastor Ogletree's church on Saturday, and we have organized a testing program where he has got a platform. We're going to test 500 of his congregation in the parking lot from 10 to 4 at his church on Saturday. And so the challenge is to get the bishops and get everyone in the churches out to say, I'm going to have those 500 at my community ready too. And we're going to come out and get folks tested, because I can't do that on my own, but they're going to listen to our community and church leaders, and we're going to be prepared to do that. That's what we're working on with our grants and our organization. And that's really what we need. We're going to bring it out to you. We're not going to have everybody necessarily have to come to us, because we're coming out, but I need to come out in a way where we can test and educate and get into treatment large portions. And so, Bishop, tell us when you have your people together, and we're going to come out and get tested. Our Cure Covad Consortium, curecovid.care is where you can get in touch with us, and we're going to make it happen. So let us know, and we're going to get that taken care of.
Okay, I'm going to put a link in the comments for all of you who are viewing this, and it's going to be to our YouTube page, because some people don't have Facebook. And what we want you to do is, we want you to take the YouTube link that we're about to post, and we want you to share it. Text it. You can copy and paste it, text it, email it, but let's really get this information out from today's interview so that we can help our communities and help our neighbors. Thank you so much.
Thank you so much.
Well, I want to thank everyone for actually joining us today. Everything that you heard today, spread the word, share it. Just like Dr. Gathe is saying it, just like July is saying it, we need to be conduits of information in our communities. And we have to trust our leaders and our medical professionals to take care of us. And it's a group effort. No one entity can do this alone. But I also, before we sign off today, I want to invite you to become a member of the NAACP. Many people don't understand that this is a volunteer organization of committed individuals who are willing to stand up and make a difference in the lives of others. It is no other organization on the planet that will help our communities like the NAACP has. In Houston, we've been around for 102 years, and in the nation, 120. So we ask that you become a part of our organization, because together we can accomplish anything. Thank you.
Thank you.
All right. You all have a great evening. And Dr. Gath, I messed it up.
Call me Dr. Joe. We're good.
You know what? Earlier today, I had it down. So my apologies. I'm gonna call you Uncle Joe. See,
all right, I'm down with that. I'm good with that.
So we do invite you to come back to CommuniTEA, whether for a special edition or on our Wednesday broadcast. This has been refreshing, informative, and truly a blessing to this platform and to everyone who will receive it later. And so with that said, thank you so much. Good night, everyone. The link is there for the YouTube. The pinned comment is so you can join our wonderful organization, the Houston branch of the NAACP. Thank you and good night.
Stay blessed. Thank you.